So from a brand new initiative to a rather more established one, you're going to hear next about Research for Life, which has been going for more than 10 years. And I'm often surprised and somewhat saddened that some of my colleagues aren't aware of Research for Life. So I think this is a really nice opportunity for us to refresh your memories and inspire you to go away and talk about it. So Richard Gedye from STM is going to come and talk to us. Bear with me, Richard.
Yes, I think that Grace is absolutely right, that we are definitely the most mature of these collaborative enterprises. So mature, in fact, I think that all the glitz and glamour of our launch activities some 15 years ago will have faded, along with many of the people who were there at the time will have gone on to other things. So I'm grateful for this opportunity to give a little bit of a revival push to the awareness of what we're doing. As it says on the board here, that Research for Life is a public-private collaboration that aims to provide developing world institutions with access to the critical scientific research that we publish. I'm told that this doesn't work, but it... Oh. Right, let's just leave that. Oh, it does. Okay. So, what's the aim of our goal? I'll come along in a minute to the nature of the collaborative partners, but just a quick revisit to what the Research for Life initiative aims to do. There's a huge knowledge gap, or there has been a huge knowledge gap, between the Northern Hemisphere industrialised countries and Southern Hemisphere developing countries in terms of access to the critical scientific research which we publish. We aim to bridge that gap by providing access currently to the research from some 16,000 journals, 46,000 books, and over 100 other information resources. And at the moment, there's over 8,000 institutions in some 115 developing countries who've currently registered to get access to this content. The way this works is that institutions in 71 of the world's poorest countries get this access at no charge, and in a further 44 countries who are slightly up the scale of economic development pay a notional figure of $1,500 a year to access the content, which is an effective discount of over 99.9%. And you're eligible if you are an institution in one of these 115 developing countries, and you're eligible basically if you're a not-for-profit educational institution, hospital, government ministry, agency, NGO, whatever, and all permanent and visiting faculty, staff members and students at these institutions can get a username and password to access this content. There are 4 programs at the moment, one in biomedicine, which is the oldest, launched in 2002, called Hinari, which is run in collaboration with the World Health Organization and also with Yale University. Agora, which offers access to content which we provide in the field of agriculture and agricultural science, which is run in collaboration with the FAO in Rome and Cornell University. One on environmental science, OARI, run in collaboration with the United Nations Environment Programme and Yale University, and the most recent one, ARDI, which looks at access to information which will encourage innovation and technology and focuses on the physical sciences and engineering, run in collaboration with the World Intellectual Property Organization. Now, as you can see from some of the names that I've just dropped, we have a number of partners which we as publishers collaborate with here, and they're listed up here. We perform our different roles. If you actually turn to the bottom of the list first, there's over 200 publishers who are contributing our content to this scheme. The scheme is quite complex, and the other partners involved have various important roles. The UN agencies are very critical in actually being able to validate that individual institutions applying for this access are who they are, that they are qualified, they are PUCA organisations who are entitled to have this access. The UN agencies are also strongly involved in running the CRM system that enables us to interface with all our 8,000 odd subscribing institutions, and also in building, developing and maintaining the authentication system that makes sure that they get access via the usernames and passwords allocated. The US university libraries here, Yale and Cornell, work very hard on cataloguing the information about the journals and books available and ensuring that this is presented into each of the individual 4 programs' user interfaces that are the front door which users enter to access the content. And a couple of technical partners, Microsoft, who have provided the authentication system and the CRM, and ProQuest, who have donated their summon discovery service, which overlays the programs and allows relatively easy discovery of content within the available journals and books. STM is involved in an oversight role. I myself am responsible for liaison with all the contributing publishers, and also at the moment I'm the chair of the Executive Council of Research for Life. And the Executive Council, I think, in a way epitomises the collaborative nature of this, in the sense that as the group that runs the whole enterprise, we have representatives from all of these partners here. There are about 7 or 8 publishers on the council, and also representatives from all of these other agencies and other partners. So it's now been 15 years since the very first programme, Hinari, was launched, and you might very well ask, well, you know, we've had quite a long time, what sort of growth have we experienced? Has the work that we've been doing had any impact at all on the intended beneficiary communities? Well, certainly you can see, just from a quick look at the growth in the number of journals that have been made available through the programme. There's been a huge increase in content that's been developed and made available over the years. But has it been used? Over the last few years, we've been working hard to gather evidence of this, and you can see on the screen here that those 2 coloured rectangles represent booklets of case studies, and the one to the right is a survey that we did looking at the impact of access to one of the specific programmes, Hinari. So Research for Life has made an impact. The first brochure here you have, the first booklet, was the result of a competition that we organised about 3 years ago, asking individual researchers and practitioners to tell us how access to this content had positively impacted upon their work and their life and their community. We had about 50 responses to this, and we took about a dozen of them, wrote them up in a journalistic fashion and published them in this book, Making a Difference. And just a few examples that you can see here. It's had a positive impact both in clinical practice but also in research. There's a doctor here in Ethiopia who was able to treat a patient with a rare condition that he could otherwise have found no solution for the treatment for, but it's also helped his hospital to deliver much more effective training to orthopaedic physicians. On the researcher side, positive impact on a researcher in Burkina Faso who, before he had access to the content, in this case from Agora, had been constantly rejected when he submitted work to international journals on the basis that his most recent reference was over 10 years old. once he got access to Agora, he was able to much more successfully get published. He also discovered that all the research work he'd been doing had been done before. So this made a transformation to his ability to conduct research and to actually discuss intelligently with researchers worldwide and compete more effectively for research funding. Similarly, it's not just a case of better patient treatment. This Nepalese paediatrician has actually been able to save children's lives as a result of the better treatment that he's been able to research and put into practice. And there's a physician who's been able to do a lot to improve the lives of HIV-infected children in Zambia. On the policy-making front, this Sudanese policymaker was able to use the information he got from our peer-reviewed, respected journals to develop some evidence-based policy that was aimed at improving the health of people in Sudan in the long term. While at ground level, here's a midwife who was able to actually considerably improve maternity care in Zimbabwe and considerably reduce maternal and neonatal mortality rates. So they can live a bit longer and can benefit from some of the developments from our leading speaker this morning. And finally, an Ethiopian physiotherapist who was able to find better ways to treat patients and to teach his students. And there's a video in which he recounts some of his experience. There's not time to see it now, but I've gathered the slides from this presentation, and the other presentations will be up on the STM website later, and you will then be able to follow that link. We also subsequently we ran a similar competition a year ago with librarians, asking them to give us some idea of how they had been able to support the work of their researchers and physicians through leveraging the content that has been made available to them, but within a library context. And once again, we wrote up some of the best competition entries, and there are published here in this booklet information about a number of librarians who've made a positive impact within their institution, have revolutionised the way their libraries are organised, and also revolutionised the way that the researchers and physicians that they serve are able to do their job. So we have here a Ugandan agricultural librarian who's actually been able to significantly boost usage of the content and significantly affect research output at his institution. This Kenyan librarian has actually embedded research for life usage across 10 campuses. Research has been fantastically improved as a result, and the status of the library as the core facility for those researchers has been significantly improved. And here's another Ugandan health librarian who's actually written a PhD on solving low research for life uptake and developing a powerful training infrastructure at not only her Ugandan university, but others as well. And training is actually pretty critical, really, in ensuring that this information is not only accessible, but is used. Oops, pressed the wrong button. And finally, 4 more librarians, which I'll quickly go through. This librarian has been very influential. For 2 years, she was president of the African Health Information Libraries Association, and she became an expert both on information technology and electronic data resources at her university as a result of access to all this content. And there's a video available once again when you see the PowerPoints on the website. You can click on that and see a day in her life and how access to Research for Life and all our publisher content has really, really positively affected the life of her and the researchers and physicians that she served. We have a Honduran medical librarian who actually was particularly tech savvy and was able to do what's actually quite important, I think, to resolve a number of security issues that had previously prevented access. his library now is a core resource. We have one of the early adopters in Nigeria who's completely revolutionised the medical and nursing curricula in her institution to include vital programs on information literacy in general and research for life training in particular. And finally, another Ugandan librarian at Makerere University whose work embedding the Research for Life content into their infrastructure has seen a very significant rise in research productivity. All this and more in that booklet. Case studies are fine, but we were also very keen to gather a little bit more widespread statistical data. And so last year we conducted a more extensive survey specifically of Hinari users to find out a little bit more about how access to the Hinari health journal and book content had affected them. We got over 1,000 respondents with a significant split between researchers and physicians, so we had a critical mass of both of those. The full report is available on the website again. There's a link coming up later on. So just a couple of slides now to show some of the positive impacts that these two universities reported. We asked researchers, first of all, how has having access to previous research via Hinari helped you? And if you look at this table here, blue is good, and there are all sorts of ways in which they reported that having access to this content has really helped them. Obviously improving scientific article writing skills, advancing their career, improving the content of their teaching, improving their ability to conduct research of their own, submitting a successful application for a grant, establishing useful contacts with researchers in other countries, succeeding in getting their own research papers published, and so on. We asked a similar question of the physicians in the survey, and as you may or may not be able to see from squinting at this chart, apart from advancing their career and winning increased respect for their work, there's a whole host of things here related to successfully developing medical practice, which has been more effective, has saved lives, helped enhance the quality of life of patients, safer practices, and so on and so forth. And in addition to answering the specific questions, we got lots of free-form positive testimonials to the value of the Hinari program. I'll just read out the first one here, which says that for us in developing countries, the value of Hinari cannot be overemphasized. It's impossible to conduct meaningful research without access to full-text articles of previous research, and only Hinari provides this for us in developing countries. The links to the two books of case studies and the Hinari survey are here. If you want to wait until the PowerPoints go up on the website, that's fine, but if you can't wait for that, there's my email address, or come and nab me afterwards and give me a card and I will send you those links in the next 24 hours. Thank you for your attention.